Topics surrounding digestion have been in the centre of recent media due to the outcry of environmental and health factors. New diets and regimes are becoming ever more so popular, but do they really aid the normal function of a digestive system or do they detriment it? To answer this question, we must first learn how the digestive system actually works. So, digestion is the breakdown of large insoluble food molecules into small water-soluble food molecules so that they can be absorbed into the watery blood plasma. The digestive system has two anatomical subdivisions. These are the digestive tract and the accessory organs. So, the main digestive tract is made up of a 30-foot long muscular tube extending from the mouth to the anus. These are the pharynx, esophagus, stomach, small intestine, large intestine. The accessory organs include the teeth, tongue, salivary glands, liver, gallbladder, and pancreas. And you can see that all listed here. So, there are 5 stages of digestion. These include ingestion, digestion, absorption, consolidation, and defecation. The initial stage of the digestive process is ingestion. This is a selective intake of the food into the body. Mastication or chewing is essential in this process as it breaks food into smaller pieces to be swallowed and creates a higher surface area to volume ratio on the food for digestive enzymes. In this stage, food is also subject to saliva. Saliva begins the fat and starch digestion. This inhibits bacterial growth, dissolves molecules to stimulate taste buds, and moists and binds food to ease swallowing. Digestion is the mechanical and chemical breakdown of food within the body. Absorption is the uptake of nutrient molecules into the epithelial cells of the digestive tract and then into the blood and lymph. Mechanical digestion refers to the physical breakdown of large pieces of food into smaller pieces which can subsequently be accessed by digestive enzymes. In chemical digestion, enzymes break down food into the small molecules the body can then use. It is important to break down macromolecules into smaller fragments that are of suitable size for absorption across cell membranes. Large, complex molecules of proteins, polysaccharides, and lipids must be reduced to smaller, simple particles before they can be absorbed by the digestive epithelial cells. Compaction is the absorption of water and consolidation of ingestible foods into feces. This occurs in the large intestine or colon. Stool, or waste left over from the digestive process, is passed through the colon by means of peristalsis, contractions, first in a liquid state and ultimately in solid form as the water is removed from the stool. The stool itself is mostly food debris and bacteria. These bacteria perform several useful functions, such as synthesizing various vitamins, processing waste products and food particles, and protecting against harmful bacteria. When the descending colon becomes full of stool or feces, it empties its contents into the rectum to begin the process of defecation. So the last step is defecation. This is the elimination of feces and is the final step of the digestive process. The rectum is an 8-inch chamber that stores the stool before defecation. If it can, the internal and external sphincters relax and we proceed to evacuate the stool. But what would happen if the normal physiological function of the digestive system failed? Well, there is a multitude of problems related to digestion and the digestion tract that all stem from the failure of its physiological function. These problems cover a multifaceted range of diseases. Some include irritable bowel syndrome, IBS, Crohn's disease, celiac disease, and acid reflux, or GERD. All of these abnormalities stem from a host dysfunctional digestive system and can be negated or even cured through a variety of ways. Gastroesophageal reflux disease, or GERD, is a digestive disorder that affects the lower esophageal sphincter. It is a chronic disease that occurs when stomach acid makes its way out of the stomach and up the esophagus. GERD is caused by frequent acid reflux. At the bottom of the esophagus, there is a tight band of muscle called the lower esophageal sphincter. If the sphincter is not functioning correctly, such as it abnormally relaxes or loses contraction potency, Stomach acid can flow back up into your esophagus, and this induces pain, and frequent occurrence lead to inflammation, esophageal bleeding, and in extreme cases, cancer. So, this induces symptoms such as a burning chest pain that travels from the lower chest upwards and in some cases into the mouth. Acid reflux and heartburn can sometimes be mistaken for GERD, but they are not chronic. If acid reflux or GERD occurs more than twice a week, it could indicate an individual has GERD. Most people can manage the symptoms of GERD with lifestyle changes. However, more serious cases will need to undergo surgery. So, surgery is usually the last resort and chooses when other lifestyle changes such as diet and sleeping habits are exhausted. There are two types of surgical procedures that GERD patients can undertake, both being minimally invasive. The first is called fundoplication. The surgery involves a surgeon wrapping the top of the stomach around the lower esophageal sphincter. This works to tighten and strengthen the sphincter. The second surgical procedure is called LINX. This is where the surgeon implants something called a LINX device, which is fundamentally a small bracelet made up of magnetic balls. He places this band around the outside of the lower esophageal sphincter. The magnets are strong enough to stay tight to prevent acid reflux from entering the esophagus, but weak enough to open to allow food to pass through the stomach.